Last year, we had our new president of the of Downstate Medical Center. Dr. Wayne Riley spoke to our alumni. This year, Dr. Riley is celebrating his 25th wedding anniversary in Greece. So he could not be here if he wanted to prolong his marriage. But we're very fortunate to have Dr. Carlos Pato, the Dean of the College of Medicine, who is going to give us an update on happenings at the medical school.
Thank you all. First of all, welcome. And for many, I know this is home, but for all those who are traveling from afar, Hawaii and elsewhere, welcome back home. And this is an extremely exciting and challenging time for Downstate. One of the things that I'm always reminded when I've come to the alumni gatherings is that our alumni are among the most successful clinicians and academics in the country. And in fact, on a personal note, my wife and I trained together at Mass General, did our residencies there. And our most important mentors were another physician couple who had graduated from Downstate and 35 years later continued to be among our closest friends. And wherever we look, there are just tremendous leaders and tremendous teachers that are amongst this very large, successful group of clinicians that we produce. And what I want to underscore is that the school is extraordinary and continues to do beautifully in almost every measurable parameter. We have incredible students, we have incredible teachers, and we learn and are actively involved in discovery in the context of a very important population and community we serve. So that's the foundation. And with a foundation like that, there's much that we can do regardless of the challenges, but I thought I would update you on what the challenges are, as well as what I see as potential opportunities. And I'm going to do it quite briefly, and then basically open it up so that if you have questions, I have an opportunity to try to answer them. Okay, so to start with, our structure. We are a state university, College of Medicine, health science university, and the era of standalone university hospitals is over. And you notice I haven't minced words. I can barely point to another standalone university hospital. Everything has evolved into systems. And state structure is not necessarily, it doesn't have to preclude systemness, but is not necessarily a structure that adapts well to a system structure. Let's make sure that we complicate the situation, which is part of the reason for this, is that healthcare is being transformed into a variety of other structures other than just primarily a focus on the doctor-patient relationship or clinician-consumer, which is a reality that people are looking at: how do we work as multiple disciplines? How do we work in an integrated way? I think I have to highlight that the support for the care of the underserved, and this is the official notes I wrote for myself, is being tremendously reduced. The actual word I used that I circled, but I'm going to share with you, is being eliminated. And that is a fundamental challenge to how we deliver care to a large portion of Brooklyn, to a very large population that's tremendously underserved. But it impacts how we perform the other missions of the university. So let me close by talking about opportunities. First of all, I think the focus for Downstate as the academic center, soul, heart of Brooklyn, is to be able to work with our whole system, and I use system under quotes because they are not integrated into a system, but our affiliate hospitals, our partner hospitals, the necessity to try to organize a ambulatory care, primary care structure that resembles as closely as possible those that have been designed to be integrated, despite many legal barriers to us functioning that way. And we can be that center that helps us address the needs of our community. And I think that's an opportunity that is tremendously exciting. And I think part of that is to realize that when things raise as true alarming issues, we have to focus not on fear, but on what opportunity those provide us. Within the last year, there have been a series of articles that have come out, most recently in the New York Times, focusing on the maternal and neonatal health outcomes in our community. And I have to say that they are tragic. And there is no reason, unfortunately, for us to sit here and feel any lack of ownership of the problem, because the problem is in our community. We have to address it. I also don't think that it's a time to wallow in self-pity and guilt because of the circumstances. It is a challenge and an opportunity for us to truly address it. And I have to tell you, this is an example of what I mean by the university, the college being able to be the center and focus. We came together and basically said, this is not a unique situation. University Hospital in Brooklyn suffers these same outcomes, regardless of major attempts to try to address them as the University Hospital of Brooklyn. Brookdale Hospital a mile away, same situation. Kings County across the street, same situation. We can also look at a new partner which, as I've been told by Pat Imperato, who is the historian that I deal with the longest, and he's clear to me that this is the reality. New partner that we are marrying for the fourth time, what makes me believe this is going to work. And I said, fourth time is a charm. The bottom line is we're in an environment where we all serve not necessarily the same population. There's a clear difference in the Maimonides population that's served. But by the way, they are the same percentage Medicaid. They are the same level of lack of services available to them. Yet, certain things they do better, many things we do better. I'd be fair, many things they do better too. The bottom line is we can learn from each other. And in maternal and fetal health, they actually have outcomes that, despite the social and economic suffering of their community, represent improved outcomes. And so let's try to learn from that. But what we've done is we've actually partnered with the state, with the private sector safety net hospitals that serve our community, with the city, and we have said, let's think through and design a system of care delivery for the mothers, for the children, that addresses the problem. And to do that, let's forget about buildings and histories and traditions and competition. Whatever we need to do, we should put on the table and then address the state, the city, and every other partner that we have to deliver the care about how do we do this best. And we are rapidly beginning to formulate something where systemness becomes an element of how we approach this. And it's not that consolidation is the answer in its own right. It may be a side effect of optimizing the care we can deliver for our community. So I said I would try to be brief, and I'm really going to stop there. Again, delighted to have you here, and really hoping to be able to answer questions that you might have. Thank you for coming.
Last week I was at a conference sponsored by Cranes, New York, and the topic was medicine in the digital era, especially with telemedicine. And I was at something at Cornell yesterday, and now they've started a program where they're following wounds, okay, from the home using and they set up a system. And they have a cooperative program with, I think with Hunter, where they have a bioscience center on Roosevelt Island with all high-tech people there.
Right.
So I'm wondering, for the downstate students, would this be an opportunity that would be open to them?
You know, I don't know about the particular program that's being run through that, but the idea of both broad digital tools that we have and certainly telemedicine is going to be not only encouraged, but we're going to try to develop that along with many other attempts to create a better linkage to the delivery of care in an ambulatory context. Clearly, the role of inpatient care is being diminished to where it's absolutely necessary. And the ability to use applications on your cell phones, you know, watches and wearables and so on, to truly monitor what's going on and to be able to understand how we can participate on a much more active way with our patients is a key part of what we need to be focusing on in terms of learning. Any other questions? Well, I hope you have a great reunion, and I look forward to seeing you often. Thank you.